Gastroesophageal reflux after peroral endoscopic myotomy, a multicenter case control study. Introduction. Peroral endoscopic myotomy, POEM, was presented clinically in 2008, with the first small series being published by Inoue et al. In 2010. As is often observed with new procedures, the initial results documenting short-term clinical efficacy and safety were exceptional. Reassuringly, with dissemination of the technique worldwide, long-term clinical success has been demonstrated. However, longer-term adverse events such as gastroesophageal reflux, GER, are not an infrequent phenomenon. In fact, based on objective data, erosive esophagitis on esophagogastroduodenoscopy, EGD, and/or abnormal pH study, the reported prevalence of post-POEM GER has been as high as 88%. When Heller myotomy was first introduced, it was not combined with an anti-reflux procedure, and a high rate of GER was noted. Subsequently, a partial fundoplication became standard practice, which dramatically reduced GER. As the premise behind the POEM procedure, in a similar fashion to Heller myotomy, is to obliterate the lower esophageal sphincter, LES, it is not surprising that post-POEM GER is encountered. There may be several reasons why there was a delay in post-POEM GER being recognized as a clinical problem. First, the early studies were focused on technical feasibility and safety, with a short duration of follow-up. Second, a large proportion of the early literature was from Asia, where GER is less prevalent. Finally, many providers initially believed that asymptomatic GER or proton pump inhibitor, PPI, responsive GER would not carry clinical consequences. Post-POEM GER is now being established as a prevalent and clinically relevant issue. However, few have modified the POEM technique or altered patient selection to prevent GER. Although scattered reports exist of adding a surgical or endoscopic fundoplication to POEM, a more efficient and elegant solution needs to be sought. One method of identifying a potential solution to post-POEM GER may be to investigate independent associations that increase the risk of GER after a POEM procedure. This may allow the operator to make adjustments to procedural technique and/or optimize patient selection. Therefore, Kumbhari et al. Aim to 1. Identify the prevalence of reflux esophagitis and asymptomatic GER in patients who underwent POEM, and 2. Evaluate patient and intraprocedural variables associated with post-POEM GER. Background and study aims. The variables associated with gastroesophageal reflux, GER, after peroral endoscopic myotomy, POEM, are largely unknown. This study aimed to 1. Identify the prevalence of reflux esophagitis and asymptomatic GER in patients who underwent POEM, and 2. Evaluate patient and intraprocedural variables associated with post-POEM GER. Patients and methods. All patients who underwent POEM and subsequent objective testing for GER, pH study with or without upper gastrointestinal GI endoscopy, at 7 tertiary academic centers, 1 Asian, 2 U.S., 4 European, were included. Patients were divided into 2 groups: 1. DeMeester score greater than or equal to 14.72 cases, and 2. DeMeester score of less than 14.72 controls. Asymptomatic GER was defined as a patient with a DeMeester score greater than or equal to 14.72 who was not consuming proton pump inhibitor, PPI. Results: a total of 282 patients, female 48.2%, Caucasian 84.8%, mean body mass index 24.1 kilograms per meter squared, were included. Clinical success was achieved in 94.3% of patients. GER evaluation was completed after a median follow-up of 12 months, interquartile range 10 to 24 months. A DeMeester score of greater than or equal to 14.72 was seen in 57.8% of patients. Multivariable analysis revealed female sex to be the only independent association with post-POEM GER. No intraprocedural variables were associated with GER. Upper GI endoscopy was available in 233 patients. 54, 23.2%, of whom were noted to have reflux esophagitis, majority Los Angeles grade A or B. GER was asymptomatic in 60.1%. Conclusions. Post-POEM GER was seen in the majority of patients. No intraprocedural variables were identified to allow for potential alteration in procedural technique.